lot of times people want to know how to do a handoff, a warm handoff. The difficulty with that is there are so many different types of warm handoffs. So when I'm talking about a warm handoff, what I mean is that a visit actually occurs. So what I'm going to do next is we're going to run through the list of the most common types of warm handoffs seen in primary care behavioral health. The peace of mind warm handoff. The PCP has a plan and feels that the patient can additionally benefit from their work with a BHC. The SOS handoff. Help! I don't know what else to do. Please, anybody, BHC? The I ran out of time handoff. It's exactly what it sounds like. I, as the PCP, have run out of time. I need a handoff. The second opinion warm handoff. PCP kind of knows what they want to do, want some reassurance with getting the BHC's second opinion, possibly on medications, possibly on behavioral interventions. The running late warm handoff is also exactly as it sounds. The PCP is running late and wants somebody, anybody, the BHC, to get in there and meet with their patient until they can get caught up on time. The heads up warm handoff. The heads up warm handoff comes from the perspective of the medical assistant. Patient gives the medical assistant a heads up on something. Medical assistant alerts the BHC, gets them in the room. The walk-in in distress warm handoff. Also what it sounds like. Patient walks in, they're in distress. Reception team is aware of this. Get the BHC in the room. Call in distress. Patient calls in, they're in distress. Nurse triages it and gets them in with the BHC right away. Reception perception warm handoff. This is where the receptionists are perceptive to what's going on in their waiting room. See a patient in distress and maybe they aren't asking for help. In that case, the receptionist gets the BHC for a warm handoff. The OB, oh my, warm handoff. This is actually a pathway we do where all initial OB appointments, you get a BHC. Leapfrog warm handoff. This is where a PCP is scheduled to meet with a patient, but instead the BHC goes in to do that appointment because it's a little bit more relevant. PCP goes on to their next patient. Right when BHC and PCP are both finishing with their respective appointments, PCP circles back around and finishes the appointment with the original patient. The alley-ooper and the reverse alley-ooper. The alley-ooper is when the patient is coming to see the medical provider. The team deems it's most appropriate to have the BHC meet with the patient. BHC meets with patient, PCP maybe has to write a script, ask a couple questions, boom, slam dunk, their visit goes by a lot more quickly and efficiently. Alley-ooper. The reverse alley-ooper. Patient comes in, is on BHC schedule. They express that they want a medication or something that only the physician or medical provider can do. The BHC conducts the majority of the visit. At the end, brings in the PCP for the slam dunk. They write the script, they get what they need. Boom, reverse alley-ooper. The cold crash warm handoff. Also see the other video on the cold crash for more information. Essentially, patient comes in at the beginning of the day, PCP gives BHC permission to meet with their patients as appropriate, maybe a new patient, maybe a patient with a chronic condition. BHC goes in without an introduction from the PCP. In summary, these were just a number of type of warm handoffs that we see. There obviously can be others. If you have ideas or suggestions, feel free to share them with us.